Okay, this video is called Kidney Cysts and the Vegan Diet. I've been a doctor over 30 years, about 35 years. I've never in my regular life had a patient, like a clinical patient. On the internet, lots of people tell me about the vegan diet, low-fat vegan and all that. But in clinical practice, in Western hospitals, I've worked in many, many different hospitals. Never once has a patient ever told me, oh, I'm a low-fat, low-sodium vegan with no oil. Okay, whole food vegan with no oil. I've heard a couple people say they're vegan, but they weren't really vegan once I talked to them a little more. Like I said, the internet's a different story because these are motivated people who seek it out. The vegan diet's by far the most powerful thing in all of healthcare for curing disease. It cures obesity, hypertension, diabetes, coronary artery disease, a lot of atherosclerosis in other locations, peripheral vascular disease, cerebral vascular disease. It very often cures autoimmune disease, arthritis, and a whole bunch of other conditions. Okay? There's nothing even close to being anywhere near as powerful as the vegan diet. But no doctors are taught this in med school. Never have I ever heard of a med school teaching such a thing. I've never heard of it recommended ever in a single medical school. I've known a couple internal medicine doctors at universities who've taught the vegan diet, and it's gotten them in trouble. There's been complaints about them by dietitians or by internal medicine attendings or residents or something. So it gets them in trouble, literally. If you go to the meetings, you'll see the big university centers recommend the Mediterranean diet, which of course is a joke. Okay. And let's see. I've also been told by internal medicine doctors that they will never, ever allow me to speak in front of an internal medicine audience. They said it would cause a chaos. It would get all the senior attending doctors upset. They'd have to relearn everything. They'd be embarrassed. It'd be an insult to their prestige. He said they would be obligated to discredit me if I ever spoke because it would be so embarrassing to them. Okay, and it's true. And I can also tell you this privately, the smartest ones, the AOAs, they come to me for personal advice about their medical problems. Kind of like with Dr. McDougall. They'll come to me for personal advice about their own personal medical problems. The best of the best of them, the absolute best of them. But they say they could never allow me to speak to an internal medicine audience, in a public center at the university. Okay. Okay, now getting to the point of kidney cysts. Now, why am I talking about this? Because kidney cysts are one of the most common things in medicine. About 70% of patients have kidney cysts. I see them all day long, every day. Most of them are obviously benign. I'm going to show you this classification called the Bosniak classification. So here's the Bosniak classification. Bosniak is the name of the guy who made the classification. So a simple cyst, it just has an outer thin wall. That's a Bosniak type 1, always benign. You can forget about it. A Bosniak type 2 has a thin septation, but it's always benign. However, here's the catch. You can have a Bosniak 2F where there's a hint of thickening of the septation, a hint of thickening of the wall. So you say, well, it's probably a Bosniak 2, but, it could be a 2F. Maybe it's a 3. Just to be on the safe side, let's follow it. I can tell you, I've seen so many of these, at least, I don't know how many exactly, but at least about 50,000 of these. Never once in 35 years have I ever seen a single one of those turn out to be cancer. Never. But there's journal articles saying they can be cancer. They can be cancer. So all people who work around imaging are afraid they're going to miss a Bosniak 2F that turns into cancer. So I recently spoke with one of my body imager colleagues, a lady attending physician radiologist with many years of experience. And I asked her, how many 2Fs have you ever seen become cancer? She's seen about as many as I have. 0. But every hospital in the Western world, every single one of them, there's no exceptions, they always do tons of kidney cyst 2F follow-up imaging. So what I said, sometimes you say before that conventional medicine is all about making money, but it's also about CYA, cover your ass. So everyone's afraid of missing a cancer. And what I'm trying to say is you could save so many more millions and millions of lives teaching people the low-fat vegan diet. But there's no interest in it because it doesn't make money. It takes too much time. It's a little bit awkward and confusing. It really takes a long time to educate a patient about it. Versus to run them through a CAT scanner, an ultrasound, an MRI to differentiate Bosniak 2 from a 2F. That's fast, okay? And a lot of times you still can't tell a 2 from a 2F, so you keep following them for years and years, and these poor patients are all worried and scared, So I'm just telling you, this is sort of the mentality. This modern world thinks it's so great with technology, but in my experience, most technology is used in a stupid way for stuff like this, okay? And there's no escape from the trap. Once you've opened up Pandora's box and started looking at these things, looking at kidneys and livers and adrenal glands and stuff, you're going to find things in this borderland zone between normal and abnormal, and you're going to be stuck following them up. There's no escape from that. So that's why it's dangerous to get a CAT scan, for example. The standard joke in radiology is, what's the definition of a healthy person? A person who hasn't had a body CT yet, meaning a CT of the chest, abdomen, pelvis. Because there's almost always an incidentaloma. Lung micronodules, adrenal nodules, atypical cysts in the liver, possible, Bosniak 2F, Bosniak 3 in the kidney, or some other thing, a sclerotic bone lesion. There's always something. So anyways, I just show you that. So, the greatest wisdom is take care of yourself. All the stuff we talked about, low fat, low sodium, 100% vegan, no oil, no caffeine, no alcohol, get your sleep, manage your stress, be religious. Because otherwise, man, you could be stuck in all these follow-ups, spend, many, many, many thousands of dollars and be stuck in limbo for 5 or more years. It's,